So let's talk about the fallacy of surgery and low back pain. Many people will go to an orthopedic or a neurologist and they'll say, I've got back pain and sciatic pain, or back pain or sciatic pain. The neurologist or orthopedist will do an MRI and find a bulging disc. And immediately he puts together back pain or sciatic pain with bulging disc and he says surgery is necessary. However, many cases it's not necessary. If we did an MRI on 100 non-symptomatic people, no back pain or sciatic pain, 33 of those MRIs would show bulging discs. What that means is bulging discs do not always cause back pain, because 33 people are walking around with a bulging disc and they're fine. So that means of patients that come in with back pain or sciatic pain, some of those bulging discs are not producing the back pain or the sciatic pain. So we have to rule out other things like spinal subluxations, meaning misalignment of the vertebrae pressing on the nerve root, or facet syndrome pressing on the nerve root. Here's what a facet syndrome is, and we find it frequently. And I find it frequently in people who've had diagnosis of bulging discs and recommended for surgery. And oftentimes just a few visits of pulling down the facets works and they don't need the surgery. So here's what the facets are. This is the low back, and these are the vertebrae or the bones of the spine. This is the superior facet of the sacrum, and this is the inferior facet of the fifth lumbar. They glide on each other. You have a pair of these on each vertebra. See how that glides up into the fifth lumbar? If it glides up too far and too high, it'll irritate the nerve root. If it irritates the nerve root, it could mimic a disc pain causing sciatica. So the solution is to take that facet and just separate it. Frequently, people with this type of pain find relief when they lay in the fetal position, because they're actually bending their knees up to their chest is pulling the facets down, taking some pressure off the nerve root. So in essence, unless you rule out those causes of back pain, meaning twisting of the vertebrae, where the vertebrae may twist and put pressure on a nerve root, or facet syndrome, where the facets jam up into the nerve root, unless you rule those out, surgery should never be done, because many times it fails. And so the insurance companies have come up with a code, a CPT code for it, called failed low back surgery syndrome. It's so common that a code was designed to describe it. So this is a type of treatment that's easily rendered in a chiropractic office, and we've done hundreds and hundreds of them. And in the last 8 years of my practice, of all the disc patients that came in, only one actually needed the surgery. So see a chiropractor before you go in and get low back surgery. Surgery is the last step that you want to take in these types of ailments. Thank you.